Hello everyone, welcome back to our GEM clinic at Harley Academy, and we've got a really good first case for the clinic today. We've got Ciara. Welcome, Ciara.
Hi.
So we're going to do a little bit of a consultation on camera. I know that off camera we've just gone through all of your history, done the consent form, but what I want to do is have a really honest chat with you about why you're here for treatment and what you're excited about, what you're nervous about, everything like that. Then we'll make a treatment plan and then we'll go. The first thing I want to say is that Ciara actually works with us at Harley Academy. She's one of our senior marketing team members, and so she's very familiar with the world of medical aesthetics, but this is the first time having any filler treatment.
Yeah, first time.
So tell me.
Well, for me, it's the under eye area. It's always been something I've been insecure about. I had a series of polynucleotide treatments, which I was really impressed with, but I think it's just something that's obviously not going to replace volume. So I think as well, I've got my dad's structure, and my dad is lacking a lot of midface volume. And I can tell as well with that within my own face, when I smile and everything, my cheeks just aren't as prominent. So I think I lack that kind of structure. And I'm getting married next month.
That's what I was hoping for. Okay, so no pressure, but how many weeks is it until the wedding?
Is it 6, 7?
6 weeks.
7 weeks till the Portugal wedding.
Okay, good. So I would say kind of 6 weeks is my cutoff before any major life event. Usually all of the filler and any kind of residual bruising or swelling will have settled within 2 weeks, but I like to probably give it 6 weeks before any major event. That would be my cutoff. So Ciara's just about made it in time for our clinic today. So let's talk through kind of what I see when we assess, and I'll talk you through what I think opportunities are, and then we can agree a plan.
Yeah.
Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
Just tell us how old you are, Ciara.
31.
31. Okay, so let's just take a little pan across Ciara's face to start with. So Ciara's got very beautiful features, really nice skin kind of radiance, good skin texture, very symmetrical features, very typically feminine aesthetic features. And so we're obviously working from a really fantastic baseline. And what we're working on here is opportunities to really add additional moments of beauty and enhancement. I don't see any particular age-related volume loss. She's only 31, and a lot of that process happens later in life. But when I do assess, I do notice a few areas where I can easily enhance. And let's work our way from the top down, okay? So even though she has a very smooth kind of muscle pattern to the upper face, if you give us a really big frown, angry, and raise up as high as you can, there's still some movement. And Ciara wants to have some toxin today. We can do that. I would just say that we don't really need to be very strong with our toxin dose at all, because her muscles are already kind of quite relaxed and we have this beautiful smooth forehead. Moving just to the temple slightly here, just notice that there is a little bit of a opportunity. I wouldn't even say this is a hollow temple at all, but I can tell from the fact that the eyebrow is starting to push downwards a little like this, that if we added some volume, just turn a little, into the temple, we're going to get a really nice lift to the tail of the brow. And I think that will be very important for the treatment plan I'm planning, which is to try and give this lateral lifting approach. So I think temporal treatment will be very beautiful. Cheekbones are very well defined, and these don't change with aging. So if you have really nice cheekbones, that's always going to be the way for you throughout your life. But what I do see is that just as we get to this far lateral posterior aspect, I can add a little bit of structure to give even more lift and definition, which I think will be very beautiful. So I think that would be a nice treatment to do today. Continuing laterally, we then have just a little bit of loss of definition at the corner of the jaw. We do have a beautiful jawline continuing all the way to the chin, but this area here, generally, if I add some volume, what I expect it would do is just create even more tightness and definition along that lower third. And then once I've done that, I can then move to the under eye area, which is Ciara's primary concern. She's mentioned that she's had polynucleotides there, which have temporarily helped, okay? But if we're going to use volumizing filler, or in this case a very low volumizing filler, we're going to get a much more long-lasting and effective treatment to the under eye, providing we inject it well in the right place with the right product. One thing I just want to assess here, if you just close your eye and I press on the eyeball like this, you just notice a tiny bulging underneath the eye. And the reason for that, you can open your eye, the reason for that is that we have little fat pads within the orbit, the intraorbital fat pads, that when you increase the pressure, they push downwards and you create these little mounds. These would be called eye bags, okay? So these are eye bags, and she hasn't got aging eye bags, but she's got an anatomy such that these little fat cushions have a tendency to push downwards. And what that tells me is that that's, first of all, one of the main reasons she has these shadows under the eyes. The second thing is that it's going to be challenging to create a really perfectly smooth transition from the from the cheek to the lid. And so we have to just bear that in mind. A lot of what we're doing with filler in this scenario is we're just smoothing that transition. There isn't a huge obvious amount of volume loss. And so I'm not going to be aggressive at all in terms of replacing volume in the anterior cheek or the under eye. So once we've done all of that, we'll bring Ciara back in 1 to 2 months' time, and we'll have a look at how it's all looking. And potentially there will be a part 2. Potentially Ciara will be very happy and want to stop there. Does that sound good?
Sounds good.
Any questions?
No, sounds good.
All right, let's get started. Okay, so let's start off by marking up the treatments that we're going to be doing today. So if you can just come off the bed slightly, look into the camera for us, and let me start off by identifying the key landmarks for the temple. So first of all, draw on this temporal crest. This is where the frontal bone drops off into the temple, and I'm going to do the superior border of the zygomatic arch, and we'll connect those up. So this becomes our temporal fossa that we can treat. And you'll notice that the hollow point, the deepest point, is around here, okay? And it's quite a narrow area of volume loss. Let's call it volume loss. But there's really no specific point that is telling me where I would like to create an injection. One thing that I do see is the visible superficial temporal artery, and you can see that pulsating just under the skin. This is a really good example to show you this artery. If I just tap this artery here, you can see it enlarge, okay? And this is a crucial artery for temporal injections. You can see this moving up the temporal fossa like this. And if I just very gently put my finger on top of it, I can feel a pulsation. So this is the superficial temporal artery. It's a branch of the external carotid artery, and it's supplying the lateral aspects of the face, and it also then moves and supplies the scalp. This is moving within layer 3 of the tissues, and so I'm very mindful with any injection that we do in the temples that I'm not going to be interfering with the superficial temporal artery. The reason this is such an important artery is because it can also have branches, these frontal branches, that then connect with the supraorbital and supratrochlear arteries. And if we have these anastomoses, then theoretically any connection to these arteries can connect to the internal carotid circulation, and therefore have these theoretical risks of vascular complications that affect the retina and can cause things like blindness. Now, I don't like to say those when my patient's about to have treatment, because these are extremely rare considerations, but they're always part of our consent form when we're talking about dermal fillers. And in this case, I am feeling the superficial temporal artery, and I don't feel any frontal branch moving through to anastomose with these internal circulation vessels. I can't palpate any artery moving that way, and so that's important because I don't have an artery moving directly across where I would want to do my injection. In this case, I'm going to use the 1 up, 1 over technique. So we find our 1 centimeter up and 1 centimeter into the temple. So just here is where I'd like to do my injection. And that will then give me a point which I think will help to create maximal elevation to the tail of the brow. This injection is down onto bone. It's a deep supraperiosteal injection. And for this, we're going to use a 25 gauge needle. So the needle size that I'm using is slightly larger than the one that we would find within the filler package. And the reason for that is because if we have a larger needle, we can improve the sensitivity of the aspiration. And in doing so, we have another way to try and improve safety with our injections. So final things is I just ask the patient to relax their jaw muscle, their chewing muscle, their masseter. That reduces the tension deep in the temple. I'm confident with my location of my injection. Patient takes a nice deep breath in and breathe out. And we touch down onto bone like this. Okay, and from this position, I'm going to do a nice 10-second aspiration. So there's no flashback in the hub of the needle here. So I'm confident now that I can now slowly inject this product, which is Reveness Shape. You'll notice that my injection angle is also at a 45-degree angle. I'm not perpendicular. That also helps to retain the product deep down underneath the deep temporal fascia when I'm injecting. The injection pressure is very slow. That also improves the safety of the injection, and it helps the product stay deep where it's intended as well. Okay, so this is half of the product that's gone in. What I'm going to do now is just slowly move out the tissues, and then I always like to apply some gentle pressure onto where I've injected in case there's a deep venous bruise that wants to appear. 20 seconds of pressure immediately after any temple injection, even if there's no bleeding at the injection site, I find is a worthwhile thing to do. How was that, Ciara?
Yeah, absolutely fine.
Pain out of 10 for that one?
1.
1 out of 10,
Yeah.
Okay. So it's a good start?
Yeah, really good.
Okay.
I was expecting less.
All right, so now let's just move some of these markings off. Turn towards me. Perfect. And I think that we can see an improvement already. If you just sit you forwards and look into the camera for us, let's see if we can see this on camera. So I just want to turn, you can hopefully appreciate here that the eyebrow here is just a little bit higher as we've started to create some more tension deep underneath the connective tissues of the face, the layer 3, for example, and that's starting to give us a little bit of lift and elevation. Really big smile as well if you can. Okay, and relax. Perfect. So far so good. The next thing is now to try and create a tiny bit of subcutaneous definition at the cheek, and we're going to also then create this same traction laterally. Generally, when we're injecting the face in sequence, we're going to start lateral and move our way medially. And so these are both good examples of injecting lateral to this line of ligaments moving through the face. And in doing so, the research has shown that if we start this way, we need less volume medially to get the same result. So what we're going to use is a cannula now to treat in the lateral aspect of the zygomatic arch. Back. And this product we're going to use here is Reveness Contour. And just turning all the way towards me, thank you very much. So I can feel here the underside of the zygomatic arch, and this is the superior border, and so I know the direction that I want to create. I'm not going to be injecting deep here. I'm going to be doing an injection just under the skin to create this really nice definition. And the reason I'm comfortable injecting just under the skin like this is because if you give me a really big smile and relax, you'll notice that this part of the midface isn't mobile, so that it won't move around if the patient smiles. This is part of what's called the static midface, and so it's okay in this region of the face to inject just under the skin. Using a 22 gauge cannula now, and make a little entry point here, 1, 2, 3. That needs to move just through the dermis, and we're now ready to follow the cheekbone in this same direction, and the majority of my volume is just going to be moving laterally, where I want to create this enhancement, this little extra ridge of definition along the zygomatic arch. Maybe 0.3 mils in total to really help with the shape. Whilst I'm here, I'm going to add some volume into the lateral cheek fat in this preauricular and subzygomatic region, and I'm just going to pass, staying in the subcutaneous depth, I'm going to move to add some volume, which will additionally help with creating lateral tension across the midface. But this is a smaller and more diffuse amount than the cheekbone that I've created, which is really going to be specifically for that additional aesthetic benefit. You'll notice as I'm injecting, there's just a little bit of resistance as I move through the subcutaneous depth, and that's intentional because we do have little fibrous divisions between the fat cushions in our subcutaneous layer, or layer 2. Now I've got Dr. Max with me, who's mic'd up, so I can also have a little chat with Max. How are you today?
I'm doing very well, thank you.
Excellent.
I love using a 22 gauge cannula here, not just from a safety perspective, but because you can so clearly see the outline of it as well. It's quite easy, particularly with newer injectors, diving a little bit too deep, and then you end up in the prostate gland. So using the 22 gauge, staying nice and superficial, always seeing the outline of it, is a really useful way of making sure that you're safe, but also that your product's going into the right place to get a good aesthetic result. And in terms of entry points as well, this is quite a universal entry point. From a single place, you can treat the zygoma. You could also treat layer 4 in the zygoma, the apex, all the way down to the mandibular angle.
Brilliant, thank you, Max. And you'll notice here, look, there is very little irregularity underneath the skin. Ciara's got nice, thick, youthful skin, but even so, I'm using Reviness Contour. It's a very moldable and soft product, while still having that medium level of lifts that we need when we're trying to do this kind of treatment in a younger patient. So that all feels like it's in the right place, and it's nice and smooth and even under my finger. And then I'm just going to use my finger here to create a little bit of definition along this new cheekbone. And let's take a look at what that's achieved. If Ciara can then look into the camera again. Straight ahead into that camera for me. Beautiful. So nothing dramatically different, but I hope you can appreciate also how nice it is to have that little bit of additional aesthetic cheekbone definition compared to this side, which is a little less defined. So when we're looking front on, her cheekbone on this side is a little higher up than this side. And that's all contributing to this beautiful feminine V shape of Ciara's face. Give us a really big smile, please. And relax. You'll notice that it still looks very natural on expression and animation as well.
I think it's actually helped the under eye area already by adding some tension to the orbicularis retaining ligament. It's made it appear soft already, which is exactly what we want. It means less filler in the under eye area, lower risks, better aesthetic result.
Head back. Now we're going to move on to, I think, the main treatment for Ciara, which is to improve the anterior cheek and the under eye itself. And I'm going to use two different products for this. I'm going to use a medium to soft G' product, which is Revinesse Ultra, to treat what's the so-called apex of the cheek. And then I'm going to move to Revinesse Revise to treat the tear trough directly. We'll talk about the products in a moment, but first of all, let's just find out where we want Ciara's most prominent apex of the cheek to live. And this is also known as something called the light reflex. So if you're having a photograph taken from you from the front, it's where does the light bounce off the cheeks? And if better to do this with you sat forwards again, if you don't mind. So where is the current light reflex? It's somewhere, I would say, around here. This is where I would say you're getting the maximum projection and bouncing of light. And anatomically, this isn't an anatomical structure. I'm not pointing towards the prominence of the cheekbone here. I'm trying to create a new prominence that's the most aesthetic for Ciara. And the way I like to find this is to find this orbital bone like this, and halfway across, I'm just going to draw my vertical line down. And this anatomically is the intersection between the medial and the lateral souph, which is a fat pad in the medial cheek. Along this line, I kind of see where I think we would like to have the most projection. And for me, somewhere around here, if I create a little bit of definition up here, for me that is a beautiful feminine apex of the cheek. And in a male, you may want to make it more around here. Okay, that might be a more masculine apex. Whereas in females, it's usually lateral and superior. So the majority of my definition is going to go here, but I might have a more secondary area of general enhancement around it. And so those two concentric circles is where I'm going to focus my effort in creating this nice apex of the cheek, which will then continue to tail off with this cheekbone that's been created. So in order to treat that, I'm going to have to make an entry point underneath it, so around here. And then this same entry point is what I'm going to use to then directly target the under eye itself. So let's start off with the cheek. So let's be moving in this direction. This will allow us to get both of those targets with a single entry point. And I've got Revinesse Ultra here. So the first thing to do is, this area is part of what's known as the mobile midface, and so we do need to be underneath layer 3. So you'll feel that I'm not even through the dermis yet, okay? So this isn't me pushing through layer 3. This is first getting through the dermis. Okay, now I'm through. Now I'm in the subcutaneous fat. I need to see this little dimple here. This dimple here is me then pushing through the orbicularis oculi muscle. It'll pop. There. Now I'm exactly where I want to be, which is in the middle of that circle, underneath layer 3, in the suborbicularis oculi fat. And here is where I'm going to focus the majority of my volume. So I'm going to fan with a cannula. That's about 0.2 mils, exactly where I want it to be. And then I'm going to use some additional volume in this second region just to connect everything up together. And honestly, that's all we had to do. We've got a very moldable product here, and so I'm going to just take the markings off, and then standing at the top of the set, just relax, yeah. I'm just going to use my finger now just to enhance the definition of the cheekbone here. But for me now, very happy with this new position of the cheek. Now let's take a look at Ciara again from the front. And here you can see this additionally higher cheekbone, this beautiful projected feminine apex of the cheek, looking at it from this side and comparing it to this side. And you can see here this OG curve, which is the the youthful shape that you see from a 45-degree angle looking at the cheek. And back into the center. Ciara, you can see yourself in that. Can you see it?
Yeah, massive difference.
Look good so far?
Yeah, really good.
Okay.
Like Matt said, it's made a big difference to the under eye
Yeah.
area. Yeah, really good.
So final thing now is we're going to treat the under eye. Now, if you give me a really big smile. So for injectors looking at this, it's not as easy as it looks. You've got this under eye roll here, which is hypertrophy of the orbicularis oculi muscle. And then we have this palpable bag as well. So there's two things that are making this an additionally complex treatment. And we have to be very, very careful and conservative when we're injecting. I'm going to use Revanesse Revise here as a extremely delicate hyaluronic acid gel with a especially low swell factor. And I'm going to be using the same entry points that I started with here. And for this one, I always ask the patient to look upwards as well. If you can just keep your eyes looking upwards, that gives me a better view of where I'm going. Okay, here we are. So I'm moving towards the under eye. I'm in the subcutaneous fat. And I'm going to have to move through the muscle again. So that's that dimple. If I just do it a little push, that's going to give way there. Now I'm in layer 4, and you can see the cannula under the eye. Turn towards me. And here's where we're going to be doing micro droplets with hyaluronic acid.
And because the skin is so thin in this area, and you haven't got much of any subcutaneous fat at all, you only need small volumes to get a good result. And we're always aiming to never fully correct, because we know that even with the product that's got very low swell factor like Revanesse Revise, you're still going to draw some water towards it. It's still hyaluronic acid at the end of the day. So correcting to maybe 75, 80%, knowing that there will be a little bit of swell over the next week or two. We can always add more. Yeah, we can take it away, but it's much easier to add more a few weeks later than it is to dissolve things if you do get lots of swelling.
Now, it's tempting in this case to also do a tiny amount underneath the skin as well. Mm-hmm. By that I mean just subcutaneous rather than underneath muscle. And that's because I think Ciara's particularly low risk of edema, and because also to get this full correction of where we have this palpable bag, it's going to be more effective if we can do this. Now, Revanesse Revise has shown to be successful at not necessarily creating edema locally. So I'm going to do a very small volume just underneath the skin to try and improve as much as I can the under eye area. So this is staying now in the subcutaneous depth rather than underneath layer 3. And we can see the difference there. It's right underneath the skin. And I'm going to do the tiniest amount under the eye.
I've been doing this a lot. In fact, I'd say for most patients who've got good skin quality, I've been doing really, really tiny amounts subcutaneously. I'm not sure I'd feel brave enough to do it with any other product. And you'll see, even subcutaneously, you will feel that little bit of resistance, and often that's not because you're popping down through orbicularis oculi or the SMAS, but rather because depending on where your entry point is, you'll sometimes be going through either the zygomatic cutaneous ligament or the orbicularis retaining ligament. So it's not always that you're going deep; you may just be going through ligaments.
Perfect. All right. So on a scale of 1 to 10, how was that pain-wise?
Yeah, probably about 5.
Okay, we got a 5 there.
Yeah, not too bad then.
Not too bad. Okay, and eyes up for me. I'm going to give it one very gentle little massage under the skin. And now let's take a look at final under eye results. Okay, so I hope you can appreciate here an improvement to the cheekbones, also the eyebrows, and also an improvement along the jawline. If you notice here, this jawline here is a little higher up compared to this side as well. So all of this has started to lift laterally. Then create this lovely new cheek apex, and then continue the treatment under the eye. I'm not going to do any more under the eye than this. And you'll notice there's still a very subtle shadow under the eye, but a significant improvement compared to the other side. And I think this is often where injectors go wrong, and they want to chase that shadow and try and completely eliminate it. I'm fairly sure Ciara will be very happy with the reduction. If you use a really big smile as well, and relax. Any additional volume in this area, given the complex factors of the palpable bag plus the hypertrophy of the muscle under the eyelid, would make this too complex for a stage 1 treatment where we add any more volume. We can always add more at a later stage. But I'm just going to show Ciara in the mirror, and then you'll get to see it. Oh, it's over there, look, go on.
Listen.
Great.
All right.
Okay, so tell us, what do you see?
Yeah, like for me, it's like how contoured my cheek is, and under eye just seems so much brighter. And it doesn't dip in as much at the bottom there. Yeah.
Happy with that?
Really happy.
Natural?
Yeah, really, really happy. Yeah,
Okay.
really good.
What I'm going to do is I'm going to do the other side now off camera, and then I'll show you the full results in the mirror. Okay, so we're back now, having treated both sides of Ciara's face. Let's just summarize the treatment plan here. So we did the temples here to try and create some lift to the tail of the brow and to create some lateral tension. And then the cheekbones themselves have had this additional really nice definition to try and continue this beautiful apex of the cheek all the way backwards and lift the height of that lateral aspect of the zygomatic arch. There's been some volume in this area to try and just create a little bit more definition along the jawline as well. And then finally, the treatment in the anterior cheek and under the eye to soften the depth of the shadows under the eyes. So I am really happy with this treatment, and we're now going to move on to the toxin treatment in the forehead and the masseter muscles. But before I do that, do we have a mirror for Ciara, please? How did you find the treatment?
Yeah, a lot. Like, it was not painful at all in the grand scheme of things. No, I'm really happy. Yeah, I mean, my under eyes so much brighter.
Is that the biggest difference you notice?
And no, my cheeks are amazing. My cheeks are really, really contoured. But I'm really, really just impressed with everything. It's brilliant.
Okay, amazing.
Thank you.
Thank you very much. So let's move on to the toxin treatment next. Okay, final treatment for Ciara today is just toxin to the upper face. It's been 4 months since she's had her toxin treatment. Give me a really big frown. Okay, so you can see the glabella movement there. It's very subtle, okay? We don't have serious dynamic muscle activity. Then raise as high as you can. We have some forehead lines. I've done my usual points for treating the forehead, but I'm only going to use 2 units per point to create quite a soft effect. And I've done 2 additional higher injections up here, which will actually contribute to heightening the hairline as well, which I think will be really nice with this kind of beautiful smooth forehead. And then really big squint, very little movement around the eyes, but enough to justify just a single injection on each side. So I'm going to show you my injection for toxin. This isn't a particularly in-depth toxin tutorial because, well, we'll do that another day. But I'm just going to do this for the purpose of showing you what Botox looks like before and after when Ciara comes back. These injections are deep to treat the medial corrugators. And then these injections are just intradermal to treat the tail of the corrugators with 2 units to create this little blanching effect in the skin. Then we move on to the forehead here, and we're just doing 2 units per point, creating these subdermal blebs. If this looks like it's fast, it's because when you do your first Botox treatment, it might take you half an hour, but once you've done enough of these, it does definitely become second nature.
How many do you reckon you've done, Tristan?
I don't know. I don't know. I've definitely treated thousands of patients. I'm not sure how many particular Botox injections. Final one around the eyes. Going to do 4 units per point. All right, so let's clean you up. And then how many more weeks is it until we're going to see you back in clinic, Ciara?
Is it 2?
Is it 2 weeks?
No, I don't know.
Oh, I mean for your follow-up.
Oh, whenever.
Okay.
When would work?
After the wedding or before the wedding?
Well, I can let you know if I've got any issues, but otherwise maybe after the wedding.
Okay. Great. Well, thank you so much, Ciara.
Thank you.
Great case study. We'll see you next time in clinic.
Thank you so much.
All right.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
Welcome back to clinic at Harley Academy. My name's Dr. Tristan Mehta, and I'm here with Ciara from our treatment a few weeks ago. So welcome back, Ciara.
Thanks.
How's it been?
Yeah, really good. Settled really, really well.
So let's talk through the treatments we did, and then I really want to get your honest feedback, and for people watching, maybe tell them a bit about the recovery process.
Yeah.
And then I want to know how you're feeling about the big day.
Yeah, of course. So we treated my temples. That was the first treatment, wasn't it? And then we went down to my cheeks, and we did some shaping and sculpting around my cheeks, and then we treated the under eye.
The under eye was one of the main concerns for you.
Yeah.
Feeling a little bit hollow here.
Yeah.
We wanted to create some shape for the cheeks.
Yeah.
We also did your Botox.
Yeah.
As well.
My forehead, yeah.
So a really classical treatment for someone in their early 30s for looking for a bit of beautification, especially if they've got a particular area that they're concerned about. In this case, it was the under eyes.
Yeah.
So for me, immediate impressions is I'm really, really happy with how everything's settled. I think you can see here really beautiful, natural result for Ciara. If I take us through it all systematically, let's start in the upper face. So big frown for me. Okay, so this is what Botox looks like 3 or 4 weeks after treatment. Very strong effect here, and raise up as high as you can. We don't have any, we don't have a frozen appearance. If you raise as high as you can, you've still got some movement of the brows, and relax. Show everyone that you can move your eyebrows still. Yeah, okay, good. And big smile. So natural appearance, okay. Exactly what we want from a the dosages that I expected, which is a slightly lower dose in the forehead. And then we move through to the midface, and I see this beautiful projection at the front of the cheek, and then we have this nice tail of the cheekbone, the zygomatic arch, and you can feel the gel under the skin. So for someone who hasn't had filler before, how does it feel to have this under the skin?
Yeah, it's a funny sensation. I'd say that it does feel like I've almost got a line. It's obviously not really obvious, like a real solid line, but it does feel like I've got more of a contoured line here that just shapes the cheek. I would say it feels harder, a harder consistency. But no, I would say other than that, it's not something that I'm really aware of.
Great. Under eyes as well. I think we've really managed to soften this. If you put your chin down and eyes forwards and look at the camera with your eyes. Yeah, that is the shot. If someone has deep under eyes, that will really show it. And after treatment, you can see we still have a little bit of a shadow, but it's a very natural effect. Did you get any puffiness under the eyes?
No, not at all.
Okay, fantastic. And what stands out the most to you after treatment?
Probably the bruising. I was I would say quite bruised, but actually in the grand scheme of things it wasn't, and it went very quickly. I've got a slight bit of bruising still, but nothing major. It was probably more bruised one side, but I think that's when I bled a little bit. Other than that, it was very smooth sailing. I had no issues at all. I wouldn't say that it was very obvious to anyone that I saw in the week after that I'd had treatment.
Okay. Did anyone say anything? Friends, family?
Just that I looked really healthy, that I just looked like I'd had a really good night's sleep, that I obviously had quite a contoured appearance, which I was very chuffed with. And yeah, my under eye area, everyone said, just looked really bright.
Yeah, amazing. What's your favourite part of the treatment, would you say?
Do you know, I just love my cheeks. I really love my cheeks, but it is, for me, it's the under eye area where I said to you the beginning stages before we did the treatment that I felt that I was continuously putting concealer on and it just wasn't actually impacting my under eye at all. And I just felt really insecure about how deep and sunken my under eye area looked. So for me to now feel like I put a tiny bit of concealer on and it immediately goes away, it's, really changed things for me, definitely.
Okay, love to hear that. And if you remember, Ciara is getting married in
a month today.
Yeah. And so this is why we say, really, I wouldn't treat Ciara today if she said, I'm looking for this treatment. And think about it, it's been maybe 4 weeks and there's still, I think, a very faint bruise here, okay? Yeah. So there's things that we wouldn't want to take any risks for see that little gentle bruise here? We don't want to take anything for granted, and things can happen. Ciara's ended up with a really nice result, but the minimum amount of time is 6 weeks for me, ideally 8 weeks. And so you're now confident 4 weeks away from your wedding, you've got no problems, it's going to be all good. The Botox can settle in a bit more. Yeah. So that's the kind of distance I'd give it. So you excited?
Yeah, no, I think it's definitely nervous. Yeah, I think it's starting to feel very real now. I feel like I've got my second Profilo today, which is like the kind of last injectable appointment now. So I feel like all of kind of my beautifying appointments are done and I'm feeling really good about just the way my skin is, and obviously like having that kind of blank canvas before I have like my bridal makeup on. So yeah, no, I'm feeling excited. For me, a couple of years ago, I was quite against filler. I think, like a lot of people, I felt very scared around the risks of it and thinking that you only had one result from filler, which was that kind of botched appearance or it migrating or the kind of complications that come with it, albeit rare. But actually having that kind of treatment where it's so subtle, it's so gradual, and you still look like you, but actually it's just enhanced the things that you liked about yourself, but also helped with the things you didn't like about yourself. So naturally, so gradually, it's really, really changed how I feel about myself. I was feeling very insecure, and it's just such small changes that made such a massive impact. So if you're considering it, obviously making sure you go with the right practitioner, someone you really, really trust, it can have a lovely, lovely impact.
Perfect. Well, thank you for that. If you want to see more content like this, we're doing a case study every month on our Harley Academy channel, showcasing our techniques. But for now, join me in wishing Ciara a fantastic wedding, and congratulations.
Thank you.
And hopefully we'll see you again soon.
Yeah, thank you.
All right, thank you.